Hi, I'm Dr. Camille, and welcome to this presentation on going over your thyroid labs. So hopefully by now you have performed your thyroid labs and you have your results back, and we're going to go over them and so that you can fully understand how to interpret them. Okay, so functions of the thyroid. The thyroid gland is really, really important. It's kind of like the metabolism and the furnace of the body. It produces hormones that regulate the metabolic rate and heat. So you'll see people who are struggling with thyroid issues being cold all the time. It helps with growth and development. It plays a role in contracting the heartbeat. So sometimes if the thyroid's too fast, you'll have kind of palpitations or tachycardia. Muscle contractions, digestive function, and bowel motility. This is very important. A lot of people struggle with constipation, and sometimes it is due to decreased bowel motility that can set you up for a lot of GI issues. The thyroid's also important for brain development, helps with bone maintenance, and also really, really important in fertility. And we will see this with a lot of women dealing with fertility issues. Their thyroid function may not be optimal. So this is just another kind of picture so you can kind of see all the organs that are involved, that the thyroid function's involved in, and you can see it's involved in brain health, eye health, lung health, liver, heart, digestive system, reproductive system, musculoskeletal system, skin. So just kind of shows you how important the thyroid is involved in basically all the body systems. So we're going to deal primarily with low functioning thyroid or hypothyroid because that is the most common. And the most common symptoms you'll see associated with a low thyroid function, primarily you're going to see fatigue. People just, I don't have the energy. I'm tired all the time. Weight gain, especially in women, you'll see, they're tired, they're gaining weight, they can't lose weight. That's a big one because, again, it's important for our metabolism. Trouble tolerating cold, we kind of talked about that. So those are kind of the big things I really look for to think if someone has a thyroid issue. Someone's cold all the time, to me, that's a low thyroid till proven otherwise. Hair loss, that's a big one. Irregular menses, fertility issues, migraine headaches, that's another big one. That's kind of what got me started on really understanding and treating thyroid function. Pale, dry skin, sadness or depression, that's interesting. But we saw in the other slides how it's important for brain health and neurologic function. And sometimes when things are just really, everything's just slow and not moving well, that can cause a type of depression, and it kind of depresses the nervous system. And then we'll see thin, brittle hair, brittle nails, that kind of stuff. Okay, we're just going to touch on high thyroid here, just kind of review some of the main symptoms, but beyond that, we're not going to go too much into it. But if you can think about like a high thyroid or hyperthyroid, kind of just the opposite of what we think of for the low thyroid, right? Like people just losing weight like crazy without even trying, a fast heartbeat or tachycardia or sometimes palpitations, pounding heart, nervousness, anxiety, irritability. And some of that's just because if your heart's racing, you're going to feel anxious. But also if, slowing down the nervous system is causing depression, speeding up the nervous system can cause excitability and irritability. Sometimes a fine tremor just because there's so much adrenaline pumping. Some menstrual cycle issues, increased sensitivity to heat because these people are just, their metabolic rate is so fast. They're just hot. Changes in bowel patterns, but this will typically be more frequent bowel movements or diarrhea. Sometimes in a large thyroid gland or thyroid nodules, and then sometimes sleep problems. Okay, so this is kind of an overview of the thyroid function, and this is really probably the most important slide for you to understand. So if you can see at the top, there's TSH, and TSH is actually coming from the pituitary gland or somewhere in the brain. Now this is really interesting because, most of you, if you've had your regular doctor check your thyroid, this is what they've done. They said, no, despite all these symptoms you're having, your thyroid's fine. And they're basing that all on the TSH. And the TSH is actually not even a thyroid hormone, it's a brain hormone. So it's can maybe be used as a screen, but it's certainly not a definitive thyroid test. So the TSH then has to go to the thyroid, stimulate it to release thyroid hormone in the form of T4. And T4 is actually an inactive storage form of thyroid hormone. So sometimes a doctor might go the extra mile and do the TSH plus the T4, but still, now we've so far checked a brain hormone and an inactive storage form of thyroid hormone. So we still have not really seen the whole picture of the thyroid, okay? Now T4 has a branch point. This is important. I did not even know about this till I got into functional medicine. But the main thing we want T4 to do is convert into T3. Now, T3 is the active hormone. This is the hormone that goes to all the cells in the whole body and plugs into all the receptors and stimulates heat and warmth and all these things. Okay, so that's really what we want. And so to me, of all these markers, T3 is the most important marker because that is the active thyroid hormone. Okay, but the other thing that can happen with T4 is that it can be converted into reverse T3. Now, reverse T3 looks an awful lot like T3, and it actually fits into the same receptors as T3. But if it gets into the receptor, it will not turn the cell on. So it's a dud. So this is really important because it's a competitive inhibitor of T3. So even if you checked all the hormones, including T3, you still could not definitively say whether or not you were in a low thyroid state until you knew how much reverse T3 there was, because this can outcompete T3 at the receptor and actually cause a low thyroid state. And then lastly, I put there in the blue box, you can see TPO antibodies. This is an important part of any workup because antibodies to the thyroid can occur long before your thyroid function decreases. But if you do have antibodies against your thyroid, it can cause symptoms of low thyroid, and sometimes it can cause swinging symptoms. Sometimes people will have high thyroid and then low thyroid symptoms because of the way the antibodies will swing back and forth. And it's only over time, if the antibodies are there unchecked for a long period of time, that they will start to sort of eat away or degrade your thyroid function. And so some people suffer for many years with thyroid symptoms, and they keep saying, no, your thyroid's normal, because it is, but it's the antibodies in the background that haven't been checked. Okay. So now, these are what your labs are going to look like, and this is how you're going to interpret them, okay? So some of these are a little bit kind of out of order how I like to describe them, but so this is a patient of mine. These are actual true patients of mine. This person came to me with severe anxiety, severe fatigue, and a lot of GI issues. Okay, this is a man. Okay, now I kind of like to go in order of that picture I showed you. So if you go down towards the bottom of that list and you see thyroid stimulated hormone, that's the TSH that's going to come from the brain. And we like to see optimal ranges between 0.5 and 2. So you can see this person is at 1.76. So that's normal for the TSH, okay? So if that's all I did and I'm your primary doctor and that's all I did, I would say, no thyroid issues, right? Okay, and then TSH goes to the thyroid and stimulates it to release T4. So you see that value below the TSH, the free thyroxine, that's the free T4. And we like to see that greater than 1. And it's at 1.33. So again, based on those two values, you have no thyroid issues, right? But remember, T4 has to be converted into T3 to be the active form. And T3, ideally, we'd like to see greater than 3. That's really the optimal range. And you can see here that this free T3 value is 2.6. So that is not in the optimal range, right? So in this case, and then that's where knowing the optimal values is really important as well, because you can see here, even on this test, the T3 is in the green, so hey, it's normal. But we know that the optimal range really is greater than 3, and so this is actually a low functioning thyroid. Now, that's not the whole picture, because remember from the last picture that T4 can also be converted into reverse T3, which is a competitive inhibitor of T3. So reverse T3, we really want to be less than 11. And if you look at this person's reverse T3, it's 21. So that's a really high number. And the body makes reverse T3 as it's an adrenal process. So if the adrenal glands are really stressed out, they will try to slow the person down by any means necessary, and they will try to convert as much of the T4 into reverse T3 as possible to slow the body down. So this person now, we've gone from, if I just did a TSH or even if I did a T4, I would say you have no thyroid issues, and yet he has a low T3 at 2.6, and he has a very high reverse T3. So this person actually, by these numbers, is in a low thyroid state. I would consider this hypothyroid, and I would consider treatment with thyroid hormone, depending on symptoms and such. Now, above that, again, because as a first-time test, a first-time screen of your thyroid, I would recommend getting the antibodies, and that's the two values on top, and those are negative. So he does not have a thyroid autoimmune condition, but he does have a low thyroid function. Okay, go to the next example. This is another person. This is a patient of mine. This is a 45-year-old female. She had come to me saying, you know, I'm really healthy. I don't really have any complaints. I do feel that as I'm aging, I want to get things checked. And I do feel, even though she worked a lot, she worked 2 jobs, super busy, a nurse. She goes, you know, I'm not having as much energy as I once did. I'm not real motivated to get through my workouts. And then let's look at her labs. So her TSH is 1. And remember, we said that optimal is between 0.5 and 2. Some people go up to 2.5. So, okay, TSH is fine. Then TSH goes to the thyroid, stimulates it to release T4. And we want that greater than 1. And she's at 1.17. So that looks fine. Then T4, we want converted into T3, the active form. And we want that greater than 3. She's at 2.9. So pretty close there. It can also be, T4 can also be converted into reverse T3. We want that less than 11. She's at 18. So some borderline numbers there, I'd say, right? The T3 is a little low. The reverse T3 is a bit high. But look at this. I checked her antibodies and they're high. So what this means is that this person, I had to tell, you know what, you have an autoimmune condition now. This is a new diagnosis of an autoimmune condition. You have something called Hashimoto's thyroiditis. And what's really, really important to know about this, and luckily it's very early, you can see the antibodies aren't that high, and it hasn't really affected her thyroid function yet. But the most important thing you can do if you're diagnosed with Hashimoto's is give up gluten. This is because gluten looks very, very similar to the thyroid. And as you continue to eat gluten, your body will attack the gluten, and then it will also attack the thyroid. So really important to find out about this early like she did, because then she can make changes and hopefully prevent too much damage to her thyroid, so she can preserve her thyroid function and not have to go on a thyroid hormone. Okay, so this just goes to show how she didn't really have any symptoms that would suggest an autoimmune condition, and yet she has one. And so that really should be part of a screen of a thyroid. Okay, this is a different person. This is a man. He came to me primarily with GI issues, but he's in his 60s. He also was having some energy and libido issues, that kind of thing. And overall, his labs aren't too bad. You see his TSH is 1.08, so right in the ballpark there. His T4 we want above 1, and he's at 1.46. His T3 we want greater than 3, and he's at 3.5. But his reverse T3 is elevated at 20.4. Again, this is an adrenal issue. He has enough T3 that I'm not worried that he's in a hypothyroid state, because he has plenty of T3, so I don't think all of it's being blocked by the reverse T3. But this is someone who I would want to work on an adrenal program with, some lifestyle changes and some herbs to nourish the adrenals to help bring that reverse T3 down. Okay. Here's another person. Now you can see that this is a lady in her 40s that came to me. Again, very high functioning, an executive, very busy, high energy individual who, you know, did admit that she was having some less energy than she previously had. We were doing some hormone stuff, but this was part of that basic workup. And you can see the TSH here is 4.4. So this is a classic example of someone who would generally be missed by a mainstream medicine or primary care provider who only did a screen and of the TSH and also only cared about if it was, quote, in range of the whole, right? You can see the normal range is 0.45 to 4.5, okay? So in this case, she's at 4.4. It doesn't matter that the cutoff's 4.5. She's still in there, so she would be normal, okay? And yet, we know that that's not optimal. Optimal is 0.5 to 2. So even if I just saw TSH, I would think that was off. But this person would be one that would not be picked up by primary care in general. But you can see that the TSH, converts to T4, and she's at 1.05, so that looks okay. But then look at her T3. That's pretty darn low at 2.5. People tend to feel that. I notice even if women can get up to the higher, like 2.8, 2.9, they can tolerate that. But 2.5, that's a pretty low number. And this is someone that I think would benefit from getting on some herbs and things to help support her thyroid, or to get on, a bioidentical thyroid hormone. You can see her reverse T3 is 8.3, so that's a great number. So that's not affecting her thyroid at all, but the T3 is low. And then below that, you can see the antibodies, and those look fine. So she does not have an autoimmune condition. She just has a slightly low functioning thyroid that she would benefit from treatment. I included this just for your reference so you can kind of see, because, when we talk about functional medicine, we want everything to be optimized. We want optimal ranges. We don't want just, you're within the range, which is from 0 to 100. It's like we know that the person at 0 does not feel the same as 100 or whatever the range is. There are set optimal ranges that we know where people feel and things function best, okay? So this is kind of giving you that guide. So we talked about TSH. The optimal range is from 0.5 to 2.5. And that's a little, some people would say even getting that closer to 2 is best, but somewhere in that range, that's optimal for your TSH. T3, now you'll notice I'm dealing with the free T3 and free T4 levels, not just a basic T3 and T4. That's because when hormones are transported in your body, they are carried by certain proteins, but when they're carried, they're bound, and so they're not actually bioavailable. So I'm most interested in the amount that's free, that's available to your cells. So that's why most of us will use the free T3 and free T4. And you can see the free T4 value, optimal reference range there is from about 1 to 1.7, and the free T3 from about 3 to 4, so greater than 3. Reverse T3, they're saying less than 15. I would say less than 11, but somewhere in that range. And then you have the antibodies, which you want less than 35, depending on what lab you're using. Okay, so basically this is just to help you hopefully figure out, maybe you did these labs because you've kind of known or felt you had a thyroid issue and you kept being told, no, it's normal. Maybe you were like that one patient that had the TSH of 4.4 and they go, no, you're normal. And it's not normal. And small lab changes can mean big things in the way you feel. So it doesn't have to be super obvious, super overt, like ruining your life, but you just go, gosh, I just don't have the energy I once did. It's hard to get all the way till bedtime with energy, or you're cold all the time. You're having trouble losing weight. Those symptoms combined with even a little bit low functioning thyroid function can really be significant, and you can have significant improvement in those symptoms with just a little bit of thyroid hormone. And so I would recommend, if those labs are showing you have some abnormalities and you're having symptoms like we described, that I would talk to, preferably some sort of functional medicine practitioner or, naturally minded practitioner that would help you with treatment and or starting a thyroid hormone. Here's some other things to consider. We talked about an elevated reverse T3. This is specifically more of an adrenal issue. The adrenal glands deal with stress responses in the body. And so I love to do adrenal tests on patients, especially, we have what's called an HPA axis. So we have the hypothalamus, the pituitary, and the adrenals. So like the thyroid and the adrenal stress hormones, as well as the sex hormones like estrogen, progesterone, testosterone. Those all kind of have to work in a balance. And so if any of those are off, like the reverse T3, really digging in and doing like an adrenal test. I love to do what's called a 4-point saliva cortisol test, because this will checking it via saliva is the most accurate, much more accurate than blood, and also because you do it 4 times during the day to see what that curve is, whereas if you do it with the blood, it's kind of like, what time did you do it? There's no reference. So it's really best to do with saliva. You can check out that test on my website. And then also, if your reverse T3 is high, just something to get you started would be a supplement called HPA Adapt. I love this one. It's a combination herbal product that has things like rhodiola, ashwagandha, things like that are really nourishing to the adrenals. And when you talk about an adaptogen, it means it adapts if it's high, it adapts if it's low. So if you have overly high functioning adrenals or low functioning, the HPA Adapt and these herbs will kind of help support it either way. Other supplements that are really important for healthy adrenal glands and the thyroid, I like this Thyroid Synergy product. It has things like trace minerals and things that are really important for the thyroid gland. And these 3 below here, I pretty much have every patient on these supplements. I say if there's 3 things that everyone needs to be on, it's magnesium glycinate, because magnesium is a cofactor in over 400 metabolic processes in our body, and it gets used up like crazy, and everyone needs to be on magnesium. B complex is kind of similar. That includes like B12, folate, all the different Bs, and Bs are really important in methylation, detoxification. They get used up. And so they need to be repleted. And then vitamin D. Pretty much everyone I've ever checked is low in vitamin D if they're not supplementing. So that's really important to be on as well. And all of those are really important for healthy thyroid function. And then some other things to consider would be like a micronutrient deficiency, to kind of say, well, why is my thyroid low functioning? There's one on my website that you can check out, with also a companion webinar of how to interpret it. But that, sometimes you don't know what supplements do I need to be on. That's a way that you can kind of specifically, oh, okay, I'm low in this and that, but not these other 5 things that I was taking. So that kind of helps guide you a bit. And just understand that this is just kind of for your information and knowledge. This isn't really intended to be medical advice. So if you have any questions or concerns, definitely talk to your healthcare practitioner about it. And I hope that helps you guys, and that you have healthy, functioning thyroids and adrenals. And I'll talk to you soon. Bye.